I'm Dr. Mike Ludlow. I'm the medical director for Progressive Hospice. I've worked for them for about 8 years now and have enjoyed the work quite a bit. So many doctors struggle with transitioning patients from health to terminal illness. We're so used to healing things that it's sometimes hard to let go, but physicians need to recognize when it is important to step back and allow the patients to pass with dignity. So with hospice, you've reached a point that they are not going to return to good health, and what we're trying to do is transition them from where they are now to death with dignity and be able to ease their pain if they're in pain and ease their anxiety if they have anxiety. And what I find most special about Progressive Hospice is the people, the nursing staff, the chaplain, the social workers, right from the owner of the company. Everyone does such a wonderful job. We have an interdisciplinary team meeting every 2 weeks to talk about the different patients that we're caring for, try to ascertain what needs they may or may not have, making sure those needs are being met. There are times that they're struggling with their breathing and they have a medicine that I think would be helpful, and it's not something that Medicare wants to pay for, and sometimes we provide samples of that to see if it'll help, and frequently that's been something they've been very appreciative of. And the fact that the nurses care enough to share that information and advocate for the patient, I think is very important. We're not hastening their death. We're trying to provide them an opportunity to live with as much quality for as long as they can, and yet we recognize that we're not trying to restore health at this point. We're just trying to preserve quality of life and transition them into that final phase.